the entire episode of the revolution that we had built to United Economic Forum. It all started in the year 2017, right? And it is not to flatter someone that I'm trying to tell, that's a reality. 2017, Jahangir was the speaker for the session. He was the chief guest for the event. And I was one of the board of directors of United Economic Forum. And I had something for a patent in antenna design. And in fact, our president, Ahmad Buhari, drew Jahangir to Forum Mall, where they did not even permit us to enter there, right? And that's where it started. 2018, again, Jahangir came. And in the floor where we spoke, I was talking about my own personal experience, my own research. That's where we came together to build this revolutionary company. We are the fastest growing company in the world. And we had really made a huge impact in the society. And we had treated more than 1 lakh patients across US and India. In India alone, north of 65,000 patients had got benefited. And US just we started 3 years back. And we are at terrible speed with which we are growing, right? And I owe completely to United Economic Forum. It's not just me. You call Jahangir and ask him, he'll tell the same story, right? That's a reality. And the best part is, United Economic Forum also holds the stocks of Twin Health, right? And that's the truth and that's the reality. So quickly to start about what is that all about? What revolution did we do, right? I'm not going to talk much on the product. I'm going to talk about what was the journey that Twin had come through, right? What is business all about and how we need to look for, right? So far we had raised 311 million. And the major investors are Sequoia, Iconic, Temasek, and recently Mage Invest. And in addition to it, high profile who's of the world, I don't want to name them for various reasons, they had invested their personal money in my company, in our company. That talks about the credibility of the product that we had built, right? And what is it all about, right? We are a monopoly. We had invented a technology, first of its kind in the world, to reverse or better manage chronic metabolic diseases like diabetes, hypertension, obesity, by solving the root cause of the problem with the dysfunctional metabolism. Right? We are able to eliminate medications. Right? And it is just not storytelling. We had proved it through conducting randomized control trial because the golden standards in medical communities to prove it through randomized control trial. We had proved it just not in India. We had done it both in India and US. Right? We have almost 70 plus publication. Again, we did not cut corners. Go look at our publications. It is published in all the best of the best journal across the globe, including the so-called NEJM, which is the best. It's a golden standard. Go talk to a medical doctor, he'll tell. Twin has a NEJM publication. That's a standard of care. Right? We did our study both in India and in US. We did it with Cleveland Clinic. Just day before yesterday, our work with detailed explanation was published in Newsweek in US. The best part here is team. The real best part is, though Twin was born in India and though Twin proved in a big way in India, do you know where it is getting celebrated? It is celebrated huge in US. In a big way it is celebrated in US. Right? And the best part is, I'll tell you, recently a set of intellect across the globe came out with a meta-analysis to talk about the reversal of chronic disease. And they completely studied across more than 5,000 studies. I'm not talking about the mundane shop which does things, right? These are some studies which is published. They picked up 5,000 odd studies and finally came and brought it down to 13 studies. And out of 13 studies, Twin study was one among them. And the best in which has delivered the results, 74% of reversal. Fantastic. Right? Really fantastic. And that is what is big about what we did. Right? And when you have great product, when you have fantastic innovation, it doesn't mean that you could be successful. It doesn't mean that you could become a unicorn. what matters the most is you need to ensure that you need to innovate in every piece of what you do. You need to be really patient enough to sustain and persistent enough in going and telling people. Right? Typically when we started in India, many people thought that we are yet another dietary program. Right? These guys are building an app and they are giving some dietary program and they are trying to solve the problem. What's the big deal? And many people joined the program. They thought that it is, hey, what is there? Why do you want to charge so much? You are just trying to show marketing gimmicks by calling all these innovation and other stuff, right? But ultimately, yes, the reality is, the truth is, the research says that unmonitored dieting is evil for a disrupted metabolic body. Right? People today talk about intermittent fasting. They say that, hey, I fasted, I reduced weight. It's very easy. Who told you cannot reduce weight by fasting? You cut the source of sugars. Sugars gets normalized. Sugars gets regulated. You lose weight. But at the expense of what? At the expense of elevated cholesterol and end organ damages. Right? You go look at all the studies and what people had published. Right? The starting point of reversal of diabetes was from UK. Roy Taylor started to do the study. And he said that with a low-calorie diet, you could reverse diabetes. But the beauty is, he did not talk about other conditions. And it was not sustainable. Right? And from there, people started to talk about intermittent fasting, keto diet, paleo diet, all these things. Ultimately, you hit some peripheral numbers. Right? You hit some peripheral numbers and you don't achieve what you want. Right? So what did Twin do? What is that revolution that Twin does? Friends, the truth is, the so-called high sugars in the blood, hypertension, obesity, fatty liver, PCOS, cholesterol, or for that matter, any of these conditions are not disease. All these superficial numbers are symptoms. And then what is the disease? Right? The real disease is the dysfunctional metabolism. The damage that has happened to your metabolism is what is the disease. Right? And is it that the medical fraternity are not aware of it? They are completely aware of it. Then why is it they are not treating it? Is it that they don't know how to treat it? They completely know what to do about it. But the real problem statement here is, metabolism is nothing but 1,000 plus biochemical reaction that takes place in a human body at every instance of time. Right? Metabolism is what? 1,000 plus biochemical reaction that takes place in every human body at every instance of time. In each of our body, now the engine is doing huge processing. Right? And Allah's creation is so beautiful that no two humans have the same metabolism. Forget about no two humans having the same metabolism. We ourselves don't have the same metabolism throughout our life. What we had 10 minutes back is not what we have now. It's so complex and dynamic. Because of its complex and dynamic nature, we did not have a way to solve it. Ultimately, high sugars are bad, high BP is bad, fatty liver is bad. You need to treat it. No other go. Doctor has to put you on medications to normalize it. But does it solve the problem? Of course, no. The reason is you are treating the symptom and not the disease. The symptom pretends to go off for the time being. That is the reason why these diseases are said to be a lifelong progressive disease with lifelong suffering of symptom, and no one knows when the complication of heart attack, stroke, Alzheimer's, cancers are going to knock us off. Right? So then we came together, me and Jahangir sat together and spoke about this. We spoke to hundreds of doctors. All these lessons, where did we learn? We were not doctors. When we spoke to hundreds of doctors, doctors told this story to us. We hired a couple of juniors, because when we go to a doctor, doctor will think, they'll talk in their professional way. Well, we hired a couple of guys. We went and spoke to them. And those guys told us the fundamentals. We read 1,000 plus hours of what is medical science all about. I personally had spoken. I keep writing a lot on the medical science to really understand the fundamental of what is it, right? And then we said that any company that's going to build a solution to measure the metabolism will be the future of the world. Any company which builds a technology or a way to measure the metabolism will be the future of the world. Can we be that company? Yes, Twin did it. Twin did it. Twin has a technology now today to measure the metabolism, the real problem. Right? Look at scary numbers. Terrible. Right? When we keep treating the symptom, and the saddest truth is, we are all wired in such a way that, hey, you become 40, you will have sugars, you will have BP, you will have knee pain. Accept it and live that life. We have been trained in that, right? Say, I had seen many people, including my own relatives, they will be diabetic, they will take medications. You go tell them, ask them, no, I am not diabetic, I am happy, I am doing fantastically well. Right? Friends, it is terrible, terrible, terrible. You will not understand about it. Right? The kind of damage that has happened, that it provides to the body is horribly bad. Right? And when we started the company, the number of diabetic people in the world, in India alone, was 77 million. Do you know the number now? It is 135 million. It is another 170 million who are pre-diabetic. Right? And as Jahangir was talking in his thing, right? Biology and behavior of every human is unique. You cannot make one problem solve one problem. So this is the dysfunctional metabolism. We are the first company in the world who have a way to measure the metabolism. Just not way to measure the metabolism. We know how to track the protein movement that happens in a human body. We have a way, literally through technology, through AI and ML modeling, we understand the protein movement that happens in a human body. And this is 1/10 of what is happening in our body. Right? And where did we all start? How did it all come through? Right? Jahangir is the one who built the solution for autonomous driverless cars. And from my side, I had spoken literally in the 2017 UF about my own personal experience with my son. Where did I learn on the medical front, right? And based on my PhD work, all these put together, we built the solution, first of its kind, to really solve the problem, right? And I'll quickly flip through this, an example of an individual. And now, talking about business innovation, we had a fantastic product. We went and told the people in India, and when we started, it was 1,40,000. We thought people will really rush to us to ensure that they are free from medication, they want to be healthy and happy, but ultimately at the end of it, no one turned up. No one turned up, right? We literally fought the battle. We went to doctors. Doctors are not happy. We proved it. Doctors are still not happy. They were happy with the science. They were happy about what we built, but they were not ready to refer patients, right? We struggled. Parallelly, interestingly, what happened is, we went to US. With all the lessons that we had learned, we went to US. Do you know what we did? In US, the payers were the insurance of the employer. The payers in US were insurance and employer. We first went to Blackstone, CEO, and told, sir, we will offer the product free of cost to all your employees. Once we deliver the outcome, you pay us. Right? All their employees who were having chronic disease, we went and put twin to them. And we said, when we reduce A1C by 1%, pay me $1,000. When we reduce weight by 5 kg, pay us $1,000. When we normalize fatty liver, pay us $2,000. When we reduce BP by 5 points, pay us $1,000. When we reduce the prescription cost by $100, pay us $30. Right? We said, we will deliver the outcome and you pay us. Finally, at the end of it, we proved that they were able to save 71% on the healthcare expenditure. And we did not talk. The CEO went public and said that this is one of its kind in the world. He went and told all the portfolio companies to join Twin. Because what I'm going to tell is, friends, a great product need not sell. But innovation, even in the way you execute the business, is also important. So the innovation is We went and told our partner, we will help you to save 2x on what you are spending so that you could pay us X. Our mantra is that, can we pay 2x to our partner so that we could pay X, right? Today in US, you name any top companies in US, they are partnered with us. Right? Any partners. The latest was Walmart and Kaiser Permanente never partners with third party for the healthcare providing solution providing. We are the partners. In Newsweek, the CEO of Kaiser Permanente has spoken about twin. And she got excited about because she got enrolled in the program. And she has, literally because of IPA, I'm not talking many things, right? So you name anything. And today the problem that, do you know what problem we are facing in twin? We are facing a problem of growth. We said no. Walmart, looking at our outcome, they said that we want to offer in all our Walmart outlets to sell it. We said no, we are not ready for it. That is the kind of growth we are seeing. Right? We are all set for IPO in the year 2027 July. Right? And we will be really hitting big, right? And in India, we need to succeed. You know what we did? We were really fighting the game. Our CAC was extremely high. We are thinking through how can we grow aggressively. We came out of the thinner version of twin called the Evergreen. A lighter version of twin. We called it as a metabolic wellness solution. And in most of the wellness offered by corporates and insurance, they were not ready to commit. And their real business was, the utilization was less than 1 or 2%. We went and told, we would commit for 30% utilization. And we told that we will commit for outcomes. And today, you name any insurance, they had partnered with us now. Every corporate want to partner with us. That's innovation. That's innovation, right? So, similarly, the product cost which was 1,40,000, today where it is? We brought in where? Again innovation. How did we control the costs? Again innovation. Last week we came with an innovation. Twin no more uses dashboard for business. We had come out with a novel first of its kind called the navigation platform, where you go click the mouse in a particular channel, it really points out the member flow. Friends, the message is, product can be great. If at all you want to succeed, you need network. You need right people to partner, right people to work with, right? And never finance was a problem. People are there to invest on you. What matters the most is, can you think and innovate daily in what you want to accomplish? Right? My time is already up. So thanks for the great opportunity. Once again, I bow in front of United Economic Forum for what we are today. And we would love to work together because I owe to B.S. Abdurrahman Saab's family in a big way. And I promise that we will partner with them in all possible ways to collaborate and take businesses to rest of the countries across the globe once we complete IPO. Thanks for the opportunity. Thank you.